Brazilian scientists have unveiled polylaminin, a breakthrough therapy 25 years in the making that could transform treatment for spinal cord injuries. Led by Tatiana Coelho Sampaio at the Federal University of Rio de Janeiro, the drug is a stabilized polymeric form of laminin, a natural protein crucial for nerve growth, axon guidance, and tissue repair. Unlike standard laminin, which breaks down quickly and loses bioactivity, polylaminin forms a durable, scaffold-like network that mimics the extracellular matrix. This structure provides a more favorable environment for regenerating axons while also reducing inflammation and limiting the spread of secondary tissue damage after spinal trauma. Preclinical and veterinary research. Over the past 2 decades, extensive animal studies have shown that polylaminin stimulates axon regeneration across injured spinal cord tissue, preserves surviving neurons by reducing secondary degeneration, restores locomotor function in rodent models of complete and partial spinal cord injuries. Building on these findings, the therapy was tested in veterinary studies with chronically paraplegic dogs. Many regained partial movement and improved gait, an extraordinary outcome given the long-standing nature of their injuries. Importantly, no major adverse effects were reported, supporting the treatment's safety. First human trial. Most recently, researchers launched a small pilot human study in patients with complete spinal cord injury, cases traditionally considered beyond recovery. Within weeks of receiving direct spinal injections of polylaminin, all surviving participants demonstrated voluntary muscle contractions below the site of injury, something considered virtually impossible in such cases. While the degree of functional recovery is still limited, and full mobility has not yet been restored, these results mark the first credible evidence that lost motor pathways can be reactivated in humans. Caution and outlook. The findings are still preliminary and awaiting peer review, and the trial was small, without a placebo-controlled arm. Long-term durability, broader efficacy in chronic injuries, and large-scale safety remain to be proven. Still, many neuroscientists are calling this a historic step in spinal cord research, comparable to the first demonstrations of neuroplasticity in conditions once deemed irreversible. If validated in larger trials, polylaminin could become a foundation for combination therapies, used alongside stem cells, neurotrophic factors, or electrical stimulation, to rebuild functional neural circuits and bring the once unthinkable goal of reversing paralysis within reach. Period.